Hello students, this is Family Systems Lecture Part 2, and I think this is working. I put the previous, uploaded the previous lecture onto YouTube and I just checked it and it looks like it's actually working, so my fingers are crossed that this might actually go, but we'll see. Okay, so now we're on Part 2 of the lecture. We're finishing up with the MRI systemic interventions, and if you turn to page 79, you'll see there's a bunch of possible interventions that you might considering. And there's the reframing on page 79. We already discussed that. The less of the same behavior prescription. So in certain situations, you might notice that it might be interesting to prescribe a change. Now, sometimes that seems a little bit impinging, but from this point of view, it can be useful. It really works with folks who are cooperative with people with big fat personality disorders. Sometimes it's hard to tell them what to do because they'll rebel and won't do it. But for cooperative clients, for example, parents are responding to a child's tantrums with more and more harsher punishment. 180-degree shift might be to build a stronger emotional bond with the child. Similarly, if a couple have a pursue-withdraw pattern, 180-degree shift would be to have the pursuer curtail pursuing and for the distancer to curtail the distancing. Because, again, once folks can see the patterns that they're acting out, they might find it interesting to shake that up. Again, there's this whole interesting paradoxical attempt to address the double bind situation. They describe a very typical heteronormative, annoying example of the husband of the wife who wants attention, and the husband's damned if he do, he's damned if he doesn't. If he gives her flowers, he only does it because she asked for them. If he doesn't give her flowers, it's because he doesn't love her. So you actually suggest that the person in the double bind maneuver out of the double bind to do something creative and different. Dangers of improvement, which is very interesting. For example, if a child becomes more independent in doing homework and getting chores done, what will the mother and father do to feel that they are parenting their son? So that helps to expose the codependency in the family when actually improvement does happening. The parental dyad, gay, straight, what have you, may start to feel some anxiety in their relating. It was easier when there was the problem, then they could direct their libido to the child. And then restraining going slow. This is a directive to go slow. It's common systematic intervention. When therapists, quote, restrain or instruct clients to go slow, they warn clients to avoid changing too fast and encourage them to take change slowly. It's a good thing to do normally in psychotherapy, and according to the author, it helps to immunize against setbacks. So if you see on pages 80 and 81, there's a really nice methodical outline of the phases of counseling. The initial phase, developing the counseling relationship, trust the system, assess for the interactional sequences. You see how different this sounds from what you might have learned in assessment and of psychopathology. Identifying ways to interrupt the interactional patterns. Initial phase, client goals, help to reframe the problems in relational context, provide prescriptions like we already discussed. Working phase, counseling task, improve the quality of the working alliance with you and the family. Working phase, client goals, paradoxical behavior prescriptions, behavioral prescriptions to interrupt, like we said in the previous lecture, to identify, assess interactional patterns, and then to interrupt them. And then increase new interactional patterns that are different through paradoxical interventions or behavioral prescriptions, and then see what happens in the closing phase. So, and then on page 82 and 83, there's a bunch of different ways to consider assessing and interventions. Take a look at all that. So I hope that gives you a little bit of an overview of a sense as to how all of this whole field of work began with the MRI school and the way that they worked, and also just a deeper appreciation of working in systems. So I'm going to close now. That's a shorter video than the previous one. I'm going to see if this one works, and then I'm going to go to the Milan school. So I hope you are enjoying this in the privacy of your home with your, maybe you're wearing your pajamas, maybe you're petting your kitty, maybe you're listening to some nice music, and maybe you're really having a lot of powerful psychedelic revelations about your own family and about your stage in life and what kind of therapist you want to be, what kind of writer you want to be, what kind of social